For years, hospitals in rural areas have closed their doors. But this trend doesn't just affect those communities, it affects everybody. I mean, think about it. If there's nowhere for patients to go in rural areas, they'll travel to more populated areas to get the care they need. More patients, more wait times, more to juggle. It's been just over a year since Martin General Hospital closed in eastern North Carolina, and surrounding hospitals, even those here in the Triangle, have felt the impacts of higher patient volume. As WRAL health reporter Grace Hayba reports, that's just one of many consequences of closing a rural hospital.
The doors here at Martin General behind me closed a little over a year ago, but it's had a big ripple effect that's still impacting families near and far.
Signs once pointing to safety in Williamston, now covered, battered, bruised.
It really kind of makes you sick to the gut. You've got nowhere to go. You've got no support.
Martin County native Yancey Warren passes by the unused medical drive often, hoping the reason he saw me there was to share news of the hospital reopening.
Really, as a patient, it's kind of scary because, your life-threatening issues can be within minutes. You know that you don't have a place to go to. You've got to go to Greenville, Edgecombe, wherever you got to go, and then every minute is part of your life you could be losing.
The slow closure began in 2019. First to go was maternity care, followed by the ICU, and eventually the remaining medical and surgical units over the next 4 years. Now, even the hospital's website tells patients to reroute to ECU Beaufort, 22 miles south.
Quorum Healthcare was operating the hospital at the time. On August 3rd at 8:30 a.m. they came in, had a meeting with the staff there and let us know that they were filing bankruptcy.
Williamston Mayor Dean McCall pulled double duty, also working at Martin General as a physical therapist. Just 2 hours after that 2023 hospital-wide meeting, he said the entrances and the emergency department were closed.
Doctors were relocated, nurses were relocated. With that comes the domino effect of patients now not knowing where their doctor is going to be or even if they can see that doctor anymore.
The area is served by 5 fire and EMS departments. The region's rural terrain on its own already presents many challenges.
Seconds do count in my job, in our profession.
Williamston Fire and Rescue Chief Michael Peaks says average transport times have now climbed from about 5 minutes to nearly 20 after the closure. Located about an hour and a half from both Raleigh and the Outer Banks, Martin General sits right along a main travel route for families heading to the beach every year. With crews tied up in longer calls, the possibility nobody is available for the next emergency is an increasingly worrisome reality.
Our job, our business is what if. So we have to prepare for the what if. What if the next call comes in while we're tied up on this one? So we're having to grow and having to adapt to waters that we've never charted before.
Waters Yancey Warren wishes they weren't in.
Completely having a building that's shutting down and dead, it's not good. At least you have the emergency room, part of something to utilize.
In Martin County, Grace Hayba, WRAL News.
Wow, a real conundrum there. And more hospitals may close in the years ahead. The Center for Healthcare Quality and Payment Reform says at least 5 other North Carolina hospitals are at risk of closing. Just 3 weeks ago, Washington Regional Medical Center declared bankruptcy. It's just 30 minutes east of Martin General. This is part of a trend nationwide over the last 20 years. UNC's Shep Center has been keeping track of this since 2005. They've got this map of rural hospital closures nationwide. You see the blue dots there? Those are hospitals that closed. The yellow dots are hospitals that converted. That means they don't have inpatient services, but they do offer some other healthcare services. There are 193 dots on this map, representing 193 situations similar to what Grace just described in Martin County. In the time that these hospitals closed, the CDC found the death rate from heart disease, cancer, injury, stroke, all increased among adults in rural areas. So what can we do about it? Enter the Rural Emergency Hospital Program, or REH. It makes it so rural emergency departments can reopen. 31 of them have opened since January 2023. Those are the blue dots on this map. There aren't any in North Carolina, but that could change soon.
It's a daunting process, but one we're taking on and trying to be a real trailblazer for the country.
So what will it take to make that happen here? Grace Hayba gets some answers in the second part of this story, and that is coming up tonight at 10 o'clock on WRAL News on Fox 50.
What an important topic. My
Yeah.
dad lives in one of those rural areas. I know what it's like. All right, thank you. Good.